The International AIDS Conference was held in the United States in this very building. The message of the conference boiled down to a number of things, that we have made a lot of progress in fighting the AIDS epidemic. In fact, so much so that we have the tools to end the AIDS epidemic. Unfortunately, often when people make that statement, they end with that statement. They read the statement as if there's a period after the word epidemic. There's not a period after the word epidemic. There's a comma at best. And the second half of that sentence is, if we take proper action. Let's be clear. We have not ended the AIDS epidemic in America. We have a long way to go, and leadership matters. Many of the folks on this panel have played a critical role in helping us get to where we are today. We expect that they have a major role in helping us get to the end game. We want to begin by thanking the members of Congress who are the hosts and co-hosts of this event, beginning with the Honorable Barbara Lee, who has been a champion on this issue even before she came to Congress, and has been steadfast every step of the way. And so we thank her for her leadership and thank her for hosting this event. She will be joining us later on. In addition to Congresswoman Lee, we have Representative Donna Christensen, who also will be joining us as a co-host, Representative Charles Rangel, and Representative Maxine Waters, both of whom will be joining us as well. I would like to begin by at least introducing our leaders, each representing a different sector of leadership. They are going to share with us their views about the role of leadership and respond to some of the presentations we're going to present this afternoon. Beginning to my immediate right, George Curry, who is the editor-in-chief of the National Newspapers Publishers Association. George has been a strong advocate in this battle and a true hero in sending out the message around HIV in Black communities. Thank you, George. After George, we have the diva herself, the amazing Sheryl Lee Ralph, who has used her voice in an extremely powerful way and has tirelessly raised the voices around HIV and AIDS, and particularly those who have been most marginalized. Welcome, Sheryl Lee Ralph. Representing industry, we have Glen Pietrandoni, who is the Senior Manager, HIV/AIDS and Hepatitis at Walgreens Pharmaceutical. Walgreens has been a leader in HIV and AIDS, particularly in the pharmaceutical realm and with pharmacies and doing best practices around the country. Welcome, Glen. Next to Glen, we have Roslyn Brock, who is the chairman of the NAACP. Roslyn is the youngest chairperson of the NAACP in the history of the organization. Welcome, Roslyn. Next to Roslyn is Representative Barbara W. Ballard, who is the president of the National Black Caucus of State Legislators. As we talk about ending the AIDS epidemic, a lot of that work is going to happen on the state level. One of the first things that we will need to do if we're to have any hopes of ending the epidemic is to fully implement the Affordable Care Act. And a lot of that work is going to happen in state legislatures across the country, including the work of defining the essential benefits packages and expanding Medicaid. So welcome Representative Barbara Ballard. Also joining us in a bit will be Dr. Avis Jones DeWeaver, who is the Executive Director of the National Council of Negro Women, NCNW, also has been a leader in this fight for quite a number of years and continues to be on the forefront on advocating on behalf of black women. And so she'll be joining us later. So to begin, we have a distinguished panel of experts who are going to give 5-minute presentations on a number of topics. Following those topics, we're going to have our leaders respond to those presentations, and then we're going to open it up to a question and answer period where those of you in the audience can either ask the leaders questions or ask the experts questions around how we're going to get to the end game. So, beginning with Dr. Vicky Cargill. Dr. Cargill is the Director of Minority Research and Clinical Studies at the Office of AIDS Research at the NIH. Welcome, Dr. Cargill.
Thank you. It's great to be here. And I think since we are going to keep to time, what I'd like to do is just go over some quick overview points. I wasn't quite prepared, but here we are. I'm going to talk to you about some of the advances that we've made in biomedical prevention and some of the directions we need to go to in the future. I think before I do that, though, we have to make sure we're all speaking the same language. What do I mean when I talk about biomedical prevention? When I mean that these are prevention measures that are both biologically based, but they require behaviors. For example, we can come up with a microbicide, but it doesn't work if someone leaves it in the shelf. So it requires two actions. It is an intervention such as a topical product or an injection such as a vaccine, which we're working on now, but also requires certain behaviors and acknowledgement of that. So some of those things would include microbicides, vaccines. You've seen much of the data that's been generated on male circumcision. Unfortunately, it appears that male circumcision is most helpful in those epidemics that are quite robust and not as mature as the one we see here in the United States. There's also pre-exposure prophylaxis, and certainly when we talk about pre-exposure prophylaxis, and I'll spend a second or two talking about that, we have to make sure that we understand exactly what happened in some of those studies. All too often I hear people saying, oh, you guys funded HPTN 052, HIV Prevention Trials Network Study 052. Clearly a landmark study, Science magazine called it the scientific breakthrough of 2011. But we have to understand how that study was done so that we can apply it appropriately. So let's first talk about some of the antiretrovirals that we can use as prevention. We have a study that was done in 2010 called CAPRISA, and that is we're now looking at putting antiretroviral therapy right into a topical gel so that women and men can use it for protection. So we're talking about vaginal microbicides and rectal microbicides, and I'll save it for our questions to have my own side comments about why we sometimes have trouble getting out the word rectal microbicide. We also have the IPREX study, which was taking a look at using a medication, an ART, like Truvada, an antiretroviral therapy, to prevent transmission among men who have sex with men, and we achieved a 44% reduction. Caution, again, the fine print. If you don't take it consistently, you are not protected. So it was a dose-response curve. The men who took the most got the best benefit. Now let's go on to HIV Prevention Trials 052, where an intensive study done with over 7 countries on 2 continents, 3 continents. How are we going to prevent transmission from an HIV-infected partner to the uninfected? It was done by providing antiretroviral therapy to the infected partner, a 96% reduction in transmission risk. Fine print. Counseling for the couple so that they could talk through the issues that are involved with a seropositive and a seronegative partner. Ongoing support. Repeated adherence counseling, ongoing discussions about condoms, the list goes on. So before we start jumping on this and saying, there's a magic bullet, in a time of shrinking resources and clinics that are overburdened with patients and don't always have adherence support, we need to put that in context. Let's go on and talk about a couple of other modalities. Even though we have found these strategies, let's now talk about some behavioral and peer navigator. And in that we can talk about the Brothers Project, where we saw taking a look at trying to enroll black men who have sex with men and not only provide testing and counseling, but linkage to care. And presented right here in this building were some of the findings that demonstrated the positive ways that that type of an intervention could make a difference. There was over 97% uptake of HIV testing among participants. You can't get antiretroviral therapy if you don't know you're infected. You're not going to go and get tested to find out you're infected if you're going to be ostracized and not be able to afford care. We don't suggest women get mammograms and then tell them when it's positive for cancer, good luck to you. We cannot do that to people who have HIV infection either. So now where do we want to go? Microbicides. We had a trial on microbicides that looked at taking a pill, Truvada. We've also now looking at vaginal rings and putting antiretroviral therapy right into a vaginal ring, which can protect women, and it gives women control over their protection. And we're also looking at using a gel like, again, antiretroviral therapy, Truvada, in a gel for women who are pregnant and lactating, because we can't forget that just because a woman's pregnant or just because she's given birth, she's not at risk for HIV infection. So we have to make sure it's safe in that setting as well. All those studies are ongoing. But in the future, we'd like to look at combination antiretroviral therapy and combination prevention. Why? I don't think it's going to be one thing. HIV occurs in a context. It's going to be a combination of behavior and biological interventions. And so that means it's going to be microbicides, it's going to be perhaps vaccines, it's going to be behavioral change, and it's also going to be looking at antiretroviral therapy, because ultimately, as Phil said, we'd like an AIDS-free generation. An AIDS-free generation is going to take a lot of work. And it's going to take requiring prevention, testing, treatment, engaging, linking, communicating, and not being afraid to say that short four-letter word, AIDS. Thank you.
Thank you. Thank you, Dr. Cargill, and particularly thank you for sticking to time. So, our next presentation is going to be the state of high-impact prevention, and we have, to do that talk, Dr. Janet Cleveland, Deputy Director, Prevention Programs Division of HIV/AIDS Prevention, CDC. Dr. Cleveland.
Hi, Phil. Thank you for that introduction. It's actually Ms. Janet Cleveland, but I appreciate you giving me that title for today. I have been at CDC for a long time, so it's a pleasure to be here. Thank you for having me as part of this panel and having CDC represented. I'm going to step back a little bit, and I'm going to try to really be brief and stay within the 5-minute period. But I thought that I would be remiss if I didn't at least help to set the context for what HIV is looking like in this country today. As you heard on the video that was shown just when this session was opening, over 1.1 million people are living with HIV in this country, and the number of persons with HIV has increased about 60% in the past 15 years. Each year, there are about 50,000 new infections in this country and about 20,000 deaths among people with HIV. So that's a net increase of about 30,000 people who are living with HIV each year. Now, at first glance, that may sound somewhat dismal to people, but actually, it's better news than we could be talking about at this point in the epidemic, because this means that through improved care and through persistent prevention efforts, we are making an impact on the epidemic. However, it also presents a challenge for prevention, as a stable incidence or new cases of HIV infection and effective treatment result in an increasing number of people with the potential to transmit HIV. HIV is a quintessential issue of health inequity in this country. African Americans are 8 times more likely, and Latinos are 3 times more likely to be diagnosed with HIV than whites. These disparities are highlighted among women. For example, the number of women estimated to be diagnosed with HIV in her lifetime ranges from about 1 in 32 African American women. And I want you just to think about that. If we were to count 32 women, African American women in this room right now, at least one has a lifetime risk of being HIV positive. HIV prevalence is associated with population density, region of residence, poverty, education, employment, and homelessness. In addition, men who have sex with men are more than 40 times more likely to have HIV than other men and women. The magnitude of the impact of HIV for gay and bisexual men is illustrated in the estimated lifetime risk of acquiring HIV among MSM. If current trends continue, half, and I want you to hear this, half of today's Black MSM will have HIV by the age of 35 years of age. By the age of 35 years, they will have HIV. And for MSM overall, half will have HIV by the age of 50. Half of all MSM. As a community, no matter what our beliefs are, HIV should not be a rite of passage for not one woman in our community and for not one man in our community. We've got to get busy. These data present a clarion call for rapid efforts. There's an urgent need to improve what we are doing, particularly in light of the new advances that Dr. Cargill has already talked about. So here's what we know. We know that daily antiretroviral therapy by people without HIV reduces acquisition by up to 73%. We know that taking daily antiretroviral therapy by people with HIV reduces transmission by 96%. Voluntary male circumcision has been associated with a 60% reduction in HIV acquisition, and more than 70 randomized controlled trials have associated behavioral interventions with reductions in risk behavior or STDs. And many of these interventions are interventions that we at CDC, with the help of our local and state partners, have been implementing well over a decade. So given a growing epidemic, a plethora of potential interventions and constricting resources, how can we reach our prevention goal? Well, CDC is implementing a new framework that Phil has already talked about, high impact prevention. And this approach applies the science of implementation to choosing, mixing and maximizing impact. Ultimately, only 25% of people with HIV in this country have a suppressed HIV viral load. And having a suppressed HIV viral load is really key and an important goal for maximizing a person's health, as well as reducing HIV transmission. Of the over 1.1 million people with HIV in this country, only 82% of those persons are diagnosed. Of those persons who are aware of their infection, only a small proportion are linked to HIV medical care. Again, Dr. Cargill talked about the necessity of making sure that we have people in medical care and just not leaving them out there to fend for themselves. People need to remain in regular care and they need to receive antiretroviral therapy. So this leaves about 900,000 people with HIV in the nation who don't have a suppressed viral load. And so that means that they have the ability to transmit the virus to others, and it also means that we have a whole lot of work to continue to do. Public health agencies, officials, systems, and yes, leaders of our community have a responsibility, to paving the way and indeed closing gaps in HIV care and prevention services. Recent guidelines recommend antiretroviral therapy for all people with HIV, regardless of immune status, yet only a quarter of people, again, have a suppressed viral load. So where do we go from here? Well, we know that we have a growing number of people with HIV and a restricted budget that requires higher impact strategies. We need to act swiftly. The window for success may be closing because the transmission rate needs to be less each year just to keep the number of new infections stable, let alone meet our prevention targets. Large health disparities require conscious application of health equity approaches, and to do that well. We will need to integrate public health prevention, care, and treatment programs for HIV. And as leaders, we will need to be steadfast in not only working to eradicate AIDS in our communities, but to also speak truth to power about what it will take to reduce new HIV infections in this country, as these will be our best opportunities to achieving an AIDS-free America. I believe that with continued dedication, passion, and commitment, these and many more challenges will be conquered. And my hope is that as we tell this story to our children and to our children's children, that we will be able to say that we made an even greater difference in the lives of people who were counting on us, because we did. Thank you.
Thank you. Next, we're going to take a turn and look at the state of AIDS among Black women in America, and that presentation is going to be given by C. Virginia Fields, President and CEO of the National Black Leadership Commission on AIDS.
Good afternoon, and members of the panel. We've heard the information as just given by Janet Cleveland from CDC. We've heard from Dr. Cargill a lot about the new science, the research, and the policies. All of that means that we now have some new realities with respect to HIV and AIDS. And as leaders, we must embrace these new realities no matter what vantage point we come to this fight from. As leaders, I believe we need to do at least certainly two things. One, we must ensure that the needs of the Black community are addressed in all relevant areas of HIV funding, programs, policies, research, and leadership positions. Two, as leaders, we must ensure that the needs of all populations that are highly impacted within the Black community are addressed. Black gay men, Black MSMs, and Black women, as you heard Janet Cleveland speak about. No population in the Black community can be left behind. Yet, we must not pit one population within the Black community against each other. We must keep all of them in the forefront and make sure that the needs are met. Third, leaders must become educated and more knowledgeable about what the needs are by way of good information, and therefore support and strengthen those programs, those initiatives, and those actions that are actually working, and demand that those things in our community that are not working be eliminated. That's speaking truth to power, and it is also taking some action. As President and CEO of the National Black Leadership Commission on AIDS, among the many initiatives that we work on, we have most recently been associated in leading an effort called 30 for 30. This is a campaign that has been funded by several sources, and we're very pleased in that we have been able to coordinate bodies from across the country of women coming together to ensure that the unique needs of women are not forgotten and are addressed in this epidemic. Through our work promoting advocacy, equity, and action in support of women living with and or at risk for HIV, we have been taking leadership. And we are especially committed to alleviating HIV-related disparities for Black and Latino women, as we've heard the numbers. Recently, we were able to host a congressional briefing for women, HIV violence and gender-related health disparities, and published 3 briefing papers calling for urgent targeted action. Those papers are available to you outside, and we hope that you will take time to read them, because each one of the papers set forth action plans which we think are important to be addressed with respect to women if we are going to turn the tide. They call for the need to expand and expedite the provision of facilitative support services and housing services for women living with and affected by HIV. Calls for the need for making women-centered integrated care more widely and readily available, including HIV services with sexual and reproductive health care and intimate partner violence prevention and counseling. And the need to produce better data and more targeted research to identify and address women's needs. We have also met with all of the leaders in positions within government to fight for the inclusion of women in the National HIV/AIDS Strategy, which was further reinforced and ultimately led to the recent passage of by the Presidential Advisory Council, a historic resolution on women. And lastly, the 30 for 30 campaign recently released a very important published paper on women, HIV, and the Affordable Care Act, which was produced in partnership with Harvard's Treatment Access Expansion Project. And we have copies of the summary of that also available, which highlights some very key recommendations including the need to expand state Medicaid plans to include new family mechanisms or services and eligibility such as routine testing, providing adequate oversight, and making sure that women are included in decision-making process at the federal, state, and local levels to ensure that the ACA and Ryan White programs are implemented in ways that meet the needs, the treatment, prevention, and care of women. So yes, as we move forward, we must address all of the populations within the Black community. But we also know that not without women, we will not turn the tide together. And as leaders, we must keep this in the forefront and remembering always, if not us, who? If not now,
when?
Thank you.
Thank you, Ms. Fields. Next, we're going to talk about the state of AIDS among Black, gay, and bisexual men, or men who have sex with men in America. And doing that talk will be Vinton Jones, Communications and Education Manager of the National Black Gay Men's Advocacy Coalition. Mr. Jones.
Good afternoon, everyone. Well, thank you. I just wanted to thank the session organizers as well as our congressional hosts for having us here, having this very important conversation about ending the AIDS epidemic in the Black community. Of course, my name is Vinton Jones, and I am the Communications and Education Manager for the National Black Gay Men's Advocacy Coalition. And we were founded in 2006, and our mission is to improve the health and well-being of Black gay men through advocacy that is focused on research, policy, education, and training. And so, for my time today, I would like to speak with you about a report that was released on the state of the AIDS epidemic among Black gay men. And so in order to set the stage, we've heard some data, but I just wanted to share some more information with you as far as the impact of the AIDS epidemic among Black gay men. And so the AIDS epidemic among Black gay men is not new. From the early times of HIV, Black gay men were at the top of new cases for this disease. And so fast forwarding 30 years later, we still continue to see Black gay men being disproportionately impacted by HIV and also dying from AIDS. And so just some key facts is that Black, gay, and bisexual men account for only 1 in 500 Americans, but 1 in 4 new HIV infections. Young Black, gay, and bisexual men saw an alarming 48% increase in new HIV/AIDS cases between 2006 and 2009, and that's about 6,500 people. Also, within that number becoming positive during that time, I also represented one of those numbers of people becoming HIV/AIDS infected. Back to the conversation of youth, by the age of 20, Black gay men have a 1 in 8 chance of becoming infected with HIV. By the age of 40, this chance increases to an alarming 60%. And so what are some of the reasons that Black gay men are still becoming infected with HIV? Diminishing healthcare access and health services utilized among Black MSM reflected by late diagnosis of HIV, suboptimal health receipt of life-prolonging antiretroviral treatments, and also poor prognosis of those living with HIV. Number 2, high background prevalence of other sexually transmitted diseases with the increase of several orders of magnitude that the likelihood that HIV will be transmitted or acquired during sexual intercourse. Sexual behavior patterns among young Black MSM, including early sexual debut and greater odds of having older, in some cases, or most cases, older partners. And also a systemic going on among Black MSM, including poverty, unemployment, violence, homelessness, experiencing childhood sexual abuse or other trauma experiences of hostile home environments, and also disruption in education and disproportionate risk of incarceration. And so as we talk about this, I want to share some action steps as we prepare for the discussion that the report also highlighted as far as what needs to be done to address the HIV/AIDS epidemic among Black, gay, and bisexual men. And some of those points are demonstrated leadership in the fight against HIV/AIDS, and that does not include within communities of Black, gay, and bisexual men. That also includes a highlighted response from the Black community, from the LGBT community, from the government community, and also from the research and public health community. Achieve saturation of HIV testing among Black MSM. Maximize the therapeutic and preventative benefits of antiretroviral therapy. Demonstrated dramatically reduce STDs among Black MSM, and also introduction of biomedical HIV prevention initiatives like pre-exposure prophylaxis. Effectively target Black MSM with high impact HIV prevention, and also building sustainable community infrastructure. And I think most importantly, being able to combat homophobia and other social challenges faced by MSM. And so to close, I would say that in order to end AIDS in the Black community, Black, gay, and bisexual men have to be a part of the conversation. Black women have to be a part of the conversation. The Black community has to be a part of the conversation if we want to end AIDS. Thank you so much.
Thank you. We're going to take just a slight diversion. We have joining us one of our co-hosts for this afternoon panel, the Honorable Donna Christensen, who has been a remarkable, remarkable leader. She snuck in thinking that we wouldn't notice, but she has been remarkable in this work, and we'd be remiss if we didn't invite her to the podium to say a few words.
Thank you, Phil. How's everybody this afternoon? It's great to see so many people in here. And we're talking about leadership, and I see a lot of leadership in this room, a lot of power in this room, and we're going to need every bit of that power going forward. You know, all of us who are in here, when we come together, when we've worked together, have been responsible for much of the progress. We've been the fuel for the engine of the progress that we've achieved in the HIV and AIDS space. From the Atlanta 30, I call them, who made sure that we in the CBC knew what was happening to our communities because of HIV and AIDS, and 14 years ago helped give birth to the Minority AIDS Initiative. To Maxine Waters, one of the co-chairs, who was the brains and the muscle, especially, well, both, behind that important initiative, and much of what has happened to improve prevention and treatment over the last 2 decades or more. Phil, who helped organize this panel this afternoon, thank you, Phil, and pulls us together often. But more than that, he makes sure that we're never comfortable with the small steps that we've been able to make. Sheryl, who raises her beautiful voice at every opportunity to let us know we can never be silent, and Roslyn, who leads the NAACP on a myriad of the health challenges that are facing us, and the other wonderful panelists that are here. And then my other co-chair. We hosted the International AIDS Conference this year, right here in DC. So let's give Barbara Lee a big round of applause for that and all of the other things that she does. And I want to just welcome everybody here this afternoon. But thank you. We know that with all of the new interventions, the hope for vaccines on the horizon, I still get the feeling that we've reached a point where in our community, especially for Black women and Black gay men, we're still standing still, or maybe even have lost some ground at worst. In my district, we still have the 3rd highest AIDS diagnosis rate in the nation. We've taken some steps forward and some backward, and don't seem to be making much progress in our infection rates. And so today, in the wake of that great conference, we're here to regroup, to re-examine, to redirect where needed, and to prepare for the opportunities that may come available and that will come available as we reauthorize Ryan White, and looking for other vehicles or creating vehicles so that we can seize on those opportunities. But first, it has to be seized at the ballot box on November 6th. And if we don't do it then, we can close this session now and go home or go and party like there's no tomorrow, because the tomorrow we might see might not be the one that we want. So I just wanted to say a few words about the Affordable Care Act. Is anyone else talking about the Affordable Care Act? Yeah.
You can certainly say.
Okay, just a few words on the Affordable Care Act, which has already been a lifeline and begun to open up access to health care for everyone, including persons affected with HIV or with AIDS. Just so we're clear on what's at stake in November. And as important as that law is, it's but one critical achievement under President Obama that would be gone if enough of us, if each and every one of us don't do the right thing on November 6th, and we are not going back. Today, fewer than 1 in 5, or 17% of people living with HIV has private insurance coverage, and nearly 30% have no coverage at all. We all know that how deficient the ADAP funding remains despite the efforts of many. I'm sure Bill Arnold is in the room somewhere, the ADAP working group and others. But the ACA, the Affordable Care Act, is changing all of that. Whether through exchanges with subsidies or Medicaid expansion, coverage will now will soon include over 30 million people who cannot afford coverage today. The no exclusion for pre-existing disease means that in 2014, adults can't be denied coverage when they're HIV positive. This began for children in 2010. Insurers are prohibited from canceling or rescinding coverage to adults or children just because they got sick, and that's what they used to do that. Lifetime limits, annual limits will be completely gone in 2014. The Affordable Care Act phases out the Medicare Part D donut hole, giving Medicare enrollees living with HIV and AIDS and all Medicare enrollees the peace of mind that they'll be able to afford their medication. In addition, the ADAP benefits are considered contributions toward Medicare Part D through out-of-pocket spending limit, which is a huge relief for low-income individuals with HIV and AIDS. There's a new affordable comprehensive benefit package that includes prescription drugs, preventive care, chronic disease management, substance abuse, and mental health treatment. That'll have a significant impact on not just those with HIV and AIDS, but on all of us. It prioritizes prevention and wellness, requiring new insurance plans to offer coverage without cost sharing for HIV screening tests for at-risk individuals. Beginning on September 23rd, 2010, insurance plans began covering recommended preventive services. Comparable provisions took effect in Medicare starting in 2011, and both reforms have helped and will continue to help people stay healthy, which is what we want to emphasize. The Affordable Care Act expanded community health centers, created community health worker grant programs, and calls for new investments in community health teams to coordinate and manage chronic diseases. And that was really exemplified in the Ryan White HIV/AIDS Treatment Extension Act of 2009, which is recognized as a pioneer in the development of that model healthcare system. In the law, we strengthened the existing offices of minority health, and we created important new ones, elevated our center to an Institute for Minority and Health Disparity Research at NIH. It bolsters the federal commitment to reducing racial and ethnic, geographic, gender, LGBT health disparities. And a key recommendation of the National HIV/AIDS Strategy is to increase the number and diversity of available providers of clinical care and related services for people living with HIV. The new law will lead to significant new investments to support critical healthcare workforce expansions and increase diversity to better serve underserved and vulnerable populations. So all of these changes will begin to improve access to insurance for people living with HIV/AIDS and other disabling conditions, and help people with these conditions retain the coverage that they have. But again, the key is that we have to do what we have to do to save this law, because it means saving us. And leadership does matter. And we have to exert leadership that ensures that we have a president and a Congress that will continue to create ladders of opportunity for everyone in this country, who understands that we are all in this together, that all must share in the burdens as well as the benefits, and that healthcare is a right that must be guaranteed to all. So thank you for all that will be shared here today. Thank you for the work that each and every one of you are doing. Yes, leadership matters, and seeing this room full of leaders should make us all hopeful for a time in the not-too-distant future that will be free of AIDS. Thank you.
So, right on time. Actually, for the record, Congresswoman Lee is actually early. We were told that she was going to be later, and she rushed in and is here with us now. So with there should be no one in this room who actually needs an introduction to Congresswoman Barbara Lee. She has been a remarkable leader. She has been instrumental in so many ways. She certainly was critical in opening the way and allowing the International AIDS Conference to come to the United States for the first time in 22 years. She is someone who's fought this battle every single day. Whenever we call, no matter what the ask is, no matter how small or how large or how few people or how many people, she responds, and she carries this issue everywhere, and that is remarkable. She doesn't just talk this talk when she's talking to us. She talks this talk everywhere she goes, and she's been a true leader. So, Congresswoman Barbara Lee from Oakland, California.
All right. Thank you. Thank you so much. And first, Phil, let me just thank you for your leadership and your inspired leadership, because I don't think any of us could do this work if it weren't for you. Every time I see you, I'm reminded that I have to do more, because we are going to see an AIDS-free generation. Thanks to all of you, and thanks to Phil, thanks to our entire panelists. So give everyone a round of applause. I'm really happy to see everyone. I remember many years ago, we started our first HIV/AIDS forum at the CBC during this weekend, at the ALC weekend, and it's grown and grown and grown. And in each year, we have specific action items and outcomes, and we generally accomplish where we say we're going. And getting on board to make sure we lifted this travel ban was one of the issues we talked about way back when. And we said, yes, we can, and others said, no, you can't. We kept saying, yes, we can, and we did. And I just have to say to Phil and to entire panelists, Sheryl, I'm so happy to see you here. Girl, you have stayed on the case, and thank you for your voice and your brilliance. And, you could be doing a lot of other things, but you're making sure we save lives. So thank you so much. But we could have just stopped and not lifted this travel ban, thinking that the obstacles were too great. But all of you are leaders, and the role of Black leadership is to take on whatever obstacle there is in our way in moving forward to an AIDS-free generation. And that was one obstacle that we were able to deal with. And so that's a real testament to what we can do if we really believe we can do it. So I just have to thank all of you, and Phil especially, for that. To Congresswoman Christensen, I was listening to her report on the Affordable Care Act, but let me tell you, I was chairing the Congressional Black Caucus during the negotiations and as the bill was coming down. And we called it the Quad Caucus. It was the Progressive Caucus, the Black Caucus, the Hispanic Caucus, and the Asian Pacific American Caucus. Well, let me tell you, each and every day we plugged along, we pushed, we moved forward. Donna led the whole fight on healthcare disparities, and she made sure that the territories were included. And we had meetings with the president and with the White House and with our leadership. And and we knew you all had our back. And so we were working on your behalf, and Donna really did a remarkable job. I think probably 85% of what we wrote and negotiated, we got into the Affordable Care Act. And so I just have to salute Congresswoman Christensen and thank her for her leadership, it was a tug of war, but we made some major progress, but we have to do more. We must do more. Now, and again, I have to just say, we all consider ourselves leaders, and there are many things that we need to do. First is work, I think, be in the front, work with our grassroots organizations. We have to be on the battlefield. We have to work with our agencies and nonprofits, and really we have to be an advocate at state and local levels for policies and funding to make HIV and AIDS a priority wherever we are. That has to happen, and that won't happen in a democracy unless people power pushes. And so we have to push to make sure that that becomes a priority each and every place we find ourselves. Also, one of the efforts that Congresswoman Christensen and I mount, it seems like it's now every 6 weeks, we get tested publicly. We were in South Africa together on World AIDS Day, and let me tell you, we saw so many young people in the audience who were reluctant at first until we spoke. And until we talked about the importance of getting tested. After we did that, after we got tested, there were lines of young people waiting to get tested. We do this in our communities, we do this in our churches, all over the country. So all of you, the role of Black leadership, get tested publicly. You know, bring people with you. Ask your pastors to get tested. It's about life or death. And remind people that this is what we must do. Also, become really involved as witnesses, as one who will provide testimony before your city council, state government, or in this instance, the federal government. Of course, we know what's happening up on Capitol Hill with the Tea Party crowd right now. But I must say that even with that, you know, our president has put forward the National HIV/AIDS Strategy and Plan, and we're fighting to make sure it is fully funded. And so the role, again, of Black leadership is to galvanize people to make sure that support is there throughout the country so that our strategy and our plan can be fully funded. And that's extremely, extremely important. Also, I want to mention a couple of things in terms of the whole issue around discrimination. I think there are 34 states and U.S. territories that have these very terrible, they're harmful and discriminatory criminalization policies in place throughout the country. And I have legislation that would actually require the Justice Department to go into these 34 states. Now, these laws were put on the books in the early 80s, and they're archaic, they don't reflect current scientific research, and they've actually been shown to discourage HIV testing and disclosure, and they disproportionately impact African Americans. So we got to get those laws off the books. We've got to get them off the books. And so when you go home, you know, if you're from one of these 34 states, and we have those states, I mean, my state is one of them, unfortunately. You too, Congresswoman Christensen. So, you know, so we're trying to work at our state level, but again, the role of Black leadership, get to folks at the State House and tell them, look at those laws. Half the people don't even know those laws are on the books until they find someone in jail who shouldn't be in jail, right. You know? And so we got to do that. We're building support for that. I don't know how many co-sponsors I have for the bill, but believe you me, it's taking off, and we have the Justice Project, which is helping us do that. So once again, get involved politically, because we're not talking about partisan politics, we're talking about political participation, and that means holding your elected officials accountable, making sure that your communities are registered to vote, and that don't just wait for elections, but in between elections, go to their offices, email them, sit in, make sure they're doing the right thing as it relates to moving toward an AIDS-free generation. Also, another bill that I've introduced, this is I think the other one was HR 305? What is it? 3053, that's the indiscrimination bill. The next one is HR 6138, which articulates a policy and a framework to achieve an AIDS-free generation. Now, here in Congress, you know, the more co-sponsors you build, the better shape you're in terms of the bill. So we have 44 co-sponsors. We just introduced this during the International AIDS Conference. So that's phenomenal. But it's a comprehensive bill that will lead us to an AIDS-free generation. But once again, the role of Black leadership, get your members of Congress, wherever you're from, to co-sponsor this bill. We know it's not going to get through this year, but believe you me, if we do our work, it'll get through next year. And so we're building now for that. And it's time that we double down also on our commitment to supporting funding for CDC and, as I said earlier, the National HIV/AIDS Strategy. And so we can make progress, and we have made progress, but we have so far to go. Just recently, we learned that in Alabama and South Carolina prisons, there are policies that keep HIV-positive inmates segregated from the rest of the population. I mean, can you imagine in this day and time? So once again, we're working with the representatives from those states and trying to figure out a strategy to do that. But again, you're going to have to be the ones leading the way. That's just downright outrageous that is taking place in Alabama and South Carolina. And so we have a lot of work to do, but I'm really hopeful, I'm really confident that we're going to accomplish the work that we all know we have to do. And it's because of you, and it's because of the fact that this inside-outside strategy, which Phil is so brilliant at putting together, where we know those of us on the inside who are fighting these battles have all of you on the outside who are our leaders pushing us and pushing others toward one end, and that is to seek an AIDS-free generation. And so I just want to thank you all very much for being here. It's wonderful to see everybody. We have these votes taking, I don't know why we're here. The votes of this Congress have been pretty ridiculous, if you know what I mean. We're not doing anything around jobs at all. All they want to do is to repeal the Affordable Care Act, which we will not let them do. But you know what you have to do. You know what you have to do come November. Thank you again.
Thank you. So our last expert is going to talk about the role of clinical care in communities. He is Derek E. Spencer, and he's the Executive Director of the Jack's Initiative Institute of Human Virology, the University of Maryland, and the School of Medicine.
So to Congresswoman Barbara Lee, Representative Donna, Christensen, Maxine Waters, in her absence, I'm not sure if she's here, to this distinguished panel and the other presenters, I'm really, really honored to be here with you today. In 2011, World AIDS Day adopted the audacious goal of getting to zero. Zero new infections, zero AIDS-related deaths, and zero stigma and discrimination. As a medical provider working in this field, working in a state that has the second highest AIDS report cases in the US, in a city, Baltimore, where 1 in 40 people have HIV, I called the epidemiologist in Baltimore and said, if it's 1 in 40 over the age of 13 of all races, what is it amongst African Americans? It is 1 in 29 people over the age of 13 in Baltimore City have HIV. Where I practice at the University of Maryland, the zip code, and 6 others in our city, 1 in 20 people have HIV in the zip code that I practice in. The goal disturbed me a bit when I think about some of the analysis from the CDC and other studies that say that of the 1.2 million people living with HIV in the United States, that 25% or less of them are suppressed. I began to be a little discouraged. But I want to tell you today a bit of my own testimony as a medical provider and why I am encouraged that now is the time to have these type of goals. Yeah. I started practicing in 1998. My first experience with HIV was in 1985 as a lab technician. At that time, 50% of the medical intensive care unit at Johns Hopkins was filled with men, mostly men between the age of 30 and 50 who were dying of AIDS. In 1998, I stepped into the field as a primary care provider. I was scared. Most of the time when I met someone, they had AIDS. They were after PCP, they had wasted, they had other opportunistic infections, and I put people on treatment from a place of sickness. I put people on treatment because they're sick. Today we know the following. If you put people on treatment with higher CD4 counts, you decrease morbidity or illness. If you put people on therapy with higher CD4 counts, you decrease mortality. We also know that when you put people effectively on treatment, the second client in the room is the community. What's good for the client is good for the community. What's good for the mama with HIV is good for the unborn child. what's good for magic is good for cooking.
You said that.
Yeah.
Yep.
And so my challenge is starting to be alleviated by medicines that are easy to take, decreased toxicity, decreased side effects. And for the first time in my life, my desire is not to put people on treatment because they're sick. My desire is to put people in treatment, Phil, because they're well. And if we do this right, they may never know what it is to have AIDS or get sick.
All right.
One of the biggest challenges we have in treatment with HIV is that most of our community, can we talk about urban communities? Most of our communities do not understand health care. They understand sick care. And they access services based on illness and not wellness. And the Affordable Care Act is the first step and a wonderful step to begin to allow our community to have access to health care. But can I say that we need to be in our elementary schools, that we need to be in our junior high schools, and we need to teach young people that the reason you go to see a medical provider is for health maintenance, disease prevention, and health promotion, not just because I'm sick. One of the things we deal with in the field of HIV is trying to transition our clients from a sick care mentality to a true healthcare mentality. My client who has a sick care mentality comes in, they get medicine, they go on therapy, they get non-detectable, and then they disappear on me. And then I don't see them again until they are sick. And that must shift, and we need leadership. We need black leaders in churches. We need black teachers. We need teachers in the arts and entertainment community. We need teachers in civic and social arena who begin to shift the paradigm thinking of how we consider medical care. From a treatment standpoint, I feel strongly that there are 4 things we're going to do well. And if we do them well, we can begin to decrease the amount of HIV in our communities. We're going to do outreach and testing. And that outreach and testing is going to also involve prevention. But then secondly, we're going to do a good job at linkage to care, where people, it does not take them 3 to 4 weeks to get an appointment, but they're going to be immediately brought into care. Thirdly, there's going to be treatment available for all persons immediately who find out that they have HIV infection. And so our goal will be early treatment. Our clinics have been like churches. And so our clinics say, well, we got 1,000 in our clinic, or we got 500 in our clinic. But that was yesterday. Today, our success will be measured in how many people in your clinic are suppressed and remain in care. Finally, one thing I want to say, if we want to change our cities, we have to engage our cities. And so everybody has to be involved. We have to create a we. To our leadership, the black leadership in this room, we are not called to do everything, but we are called to do something. What is your something? And let's do that well. Thank you.
Well, we have been joined by the Dean of the Congressional Black Caucus. The Honorable Charles Rangel has entered the room, and we're glad to have him join us. Talking about leadership, Congressman Rangel called us. Normally we have to beg members to come, but Congressman Rangel called us and said, I want to be there. I want to be a part of this conversation. And that is what leadership is all about. And he has stepped forward consistently on this issue, and we're glad to have him with us this afternoon.
Thank you, thank you, thank you, thank you, thank you. But most of all, thank all of you for being missionaries in this struggle where we know that we have the answers to this terrible disease in our hands, and all we have to do is to wake up and to use it. It's all about not a terrible contagious disease, it's all about education. That's what it's all about. And we're so lucky here in the Congress to have Donna Christensen. She's one of the most modest people that I've met in my entire life. Not only is she a doctor and a representative of our wonderful citizens in the Virgin Islands, but she takes this as a mandate that she has based on the talents and education that she has acquired to first teach us as a representative in the Congressional Black Caucus, but therefore the country. And of course, Maxine Waters, what can I tell you? And from my own hometown to have a person like C. Virginia Fields, who has the background to do anything that she wants to do, in leading the great borough of Manhattan, which I really thought for many years was New York City, but hey, you know, don't want to get in trouble with Brooklyn. And when there was a vacuum, to see her jump into this and follow Deborah House and to bring together all of our ministers together, thank you so much, Virginia, for being Virginia Fields. I mentioned the ministers, and the older I get, the more I start paying more attention to them, because I don't want no mess with St. Peter when I get up there, you know. I just want to get my place and tell God that I've been waiting for her to greet me for a long time, and let's move on, and, you know.
I heard that.
Right. But I remember not too long ago, I was receiving a little award at one of my local churches, and the minister was so carried away with my presence there that I was listening to him, and I just thought he was about to preach me on the way to heaven. I just got so carried away with myself, but it never seemed like he got around to actually introducing me to say anything. And then just when he was about to sit down, he said, but there's one thing, though. There's just this one thing, this thing he got with same-sex thing. And oh, my God, he took off on gays and took off on same sex, and then he got carried away with AIDS, and this is God's wrath, and then he apologized, and he said, I saw something happen there that was just an experience, you know, knowing the organ player as well as I did. But I say, and knowing his colleagues as well as I did as well. But how far we've come. How far we have come. I don't know how many ministers we put together. Reverend Butts headed the group there, and T.D. Jakes and all those people, evangelists and whatnot, have finally understood that if God wanted us to do anything, it's to take care of ourselves in this body that she's given to us, right? And like the previous speaker said, we should not be dealing with getting doctors for sickness. We should have doctors and nurses and people for wellness. Ain't no sense being sick if you can avoid it. So I know you're doing good work, and if I get up there before you, I'll tell her I got a whole lot of people that put in dues. They went out front. They were missionaries. They did things that were not popular because they were trying to help all of the people that she's put on this earth. So God bless all of you. They put more on me today and tomorrow and the rest of this weekend than I can bear, but I can't let them know. So I have to go back on the hill, but I'm just so glad to see your faces, the work that this wonderful panel is doing, and that gorgeous lady sitting in the middle. If I wasn't so happily married, but every once in a while the devil does these things. You know, the devil brings her every now and then. We just smile at each other and give a nod, but I better get on before I get in any trouble. Thank you so much for that.
Thank you, Congressman Rangel.
Thank you.
So, leadership does matter. We have a panel of distinguished leaders with us this afternoon. I'm going to start to my immediate right with George Curry, who's the editor-in-chief of the National Newspaper Publishers Association and part owner of Heart and Soul magazine. and was the founder and the owner of Emerge magazine. So when we talk about ending the AIDS epidemic, a part of that work is sounding the alarm. So as a leader, and often, as I say, as the godfather of black journalism, what role do black journalists play in ending the AIDS epidemic and sounding the alarm?
I don't know about the godfather part. When he died, they kept him up above ground about a month. So. First of all, any more NNPA publishers here? I see Bobby Hinder here. I want to first say that I'm allowed the freedom to do my work at the NNPA, and we have a bunch of publishers who have not always been there, who understand the problem, and they dedicate their pages every week to it. So one, is good to be in a supportive environment. The other thing is, I can relate to Barbara Lee when she said, when you see Phil, you're inspired, but you also start wondering, what else can I do? Because you might as well wonder, because he's going to ask you. And I just think that, we all of us have to realize, whatever area we're in, there's a reason we're there. The reason I went into journalism is because I want to give voice to the voiceless. If I'm not going to do that, I need to go do something else. And so all of us in our respective communities have to say, what skills do we have? And for me, I'm a straight man, and I don't see enough voices out here in our community of straight black males who are part of this cause. Because let's face it, of course there's still homophobia in our community, but when we talk about our community, we got to say, look, if you think this is just to the gay community, you're absolutely crazy. When you look at the numbers and say, first of all, there were 12% of the population in 44% of the cases, that women, black women, represent 64% of all new infections, 85% heterosexuals. When you look at teenagers, 15% of blacks represent 15% of all teenagers, 70% of all AIDS diagnoses. This thing permeates our community. And so for me, Phil came by to visit me the first time. This is my second inclination with NNPA. And we just started talking. He did the same thing to the black ministers. And he just kind of grabbed us in our collar saying, look at these numbers. And you look at these numbers over the years, you kind of gloss over them. But when you sit back and you look at these numbers, and how they're destroying our communities, you say, what can I do? So the role of a black journalist, like any other community, we all have our responsibilities. We have to keep this issue at the forefront, show that you just can't stereotype into any one group, and that if we don't do something about this, we're not going to be around.
Thank you, thank you, thank you. Sheryl Lee Ralph, you've been in this fight from the very, very beginning. You're a big star. And at a point in your life when you had Broadway at your feet, you didn't have to take on this issue, but you did. So what role do black celebrities play, and folks who have the opportunity to get the media's attention, play in ending the AIDS epidemic?
It's very interesting. I think people like stars. People will buy things that stars do, say, wear, write, and I never had it in my mind to use my celebrity to do that. How I got involved in this fight is very, very simple. I was an original company member of Dreamgirls on Broadway in thank you. In 1981, and I stood witness to what I remember as an ugly time in America. I saw men up and down Broadway drop dead of a mysterious disease that had no name. They got sick and they died. They got sick. Some of them developed those strange purple marks on their bodies and they died. and they died under stigma, shame, and silence. Many of them died not knowing or having anyone to hold them, much less hold their hand. And as a kid who was raised in church, learning do unto others as you would have them do unto you, not do unto them before they do unto you, I said that we have to be better human beings. We have to be able to care for each other no matter what. And these were my friends. And in my mind, anybody who could help you with your wig, weave, weft, and wardrobe problems.
Come on now.
Come on. You had to remember your friends.
That's right.
But more important, they were loving children of God who died of a mysterious disease. Well, that disease we now know as AIDS, because they didn't die of HIV. They died of AIDS. They just got sick and died. But in those 3 years while I was on Broadway watching it, it just kept happening. But for me, through my eyes, it was never just gay white men. Never. Because I saw Sharon Red get sick and die. I saw Sherry, another girl, Sherry, get sick and die. I saw a whole lot of men who were not white men die. But even then, nobody was talking about them in their dying, but still, I said we must do something about this. And that is when I founded the Diva Foundation. And people said, Diva? Why Diva? Diva is an acronym. Divinely inspired, victoriously AIDS aware. And I started that because I remember being in a room with Elizabeth Taylor, God rest her soul. And why Elizabeth Taylor had the wherewithal to talk to me about what I was doing, because there were a whole lot of other people in the room, and then there was little black me over there. And that woman, oh, people were saying such horrible, ugly things. And that woman looked at me and she said, oh, Sheryl Ralph, you've just got to keep doing what you're doing. Most of these people couldn't find their ASS from a hole in the ground. And then there's you. Just keep doing what you're doing. And I said, oh, look at that diva. Diva. And it just kept moving me forward. And Divas is going to turn 22 years this year. Right. And thank you. And in doing so, we also created what you know is the longest consecutive running musical AIDS benefit in the country. Not anybody else has been doing one thing consecutively as long as we have been doing it each and every year to raise awareness around this disease. Because we have got to touch your heart. This disease is a test of our humanity. This disease is a test of how much do you love yourself to keep yourself negative. Something's going on that we are not taking care of ourselves. And it's not just HIV and AIDS that we're falling to, heart disease, any other STD that's out there, high blood pressure, stroke, who's number one? Us. And it's all preventable. So with Divas, we believe in the transformational power of the arts to keep you connected. I do a one-woman show called Sometimes I Cry, where I tell real women's real stories around HIV and AIDS. We created another program called Test Together. My husband and I, Senator Vincent Hughes and myself, where we encourage couples, mothers, take your daughters how to learn to be sexually responsible. Fathers, take your sons how to learn to be sexually responsible. Lovers, take each other. Heterosexual lovers, homosexual lovers, transgender lovers, take each other. Go and get tested. Testing, you've heard it. Knowing your status can change the status of your life. We created the Sister Circle, where I brought together 25 HIV positive women and took them to South Africa to meet with over 125 South African infected women. We created a program where we started exchanging beadwork, and when the ban was lifted, we brought one of those women up to participate in the International AIDS Conference, and it was something when she put her feet in Washington, D.C. She said, "My sister, I am here." So we continue with Divas each and every year to bring artists, celebrities who share our vision, who share our understanding, who share our knowledge. Heck, we even did a Divas Simply Singing with the Sigma Gamma Rho sorority, talking about HIV and AIDS. So there's so much that celebrities can do, but don't look to them just cause they're celebrities. Look to them because they share the passion, because they understand the cause. Because if people don't have passion for AIDS, there is no reason to get involved. It don't pay at all. And nobody is gonna set you up on a pedestal. They're all gonna ask you what they ask me all the time. What's wrong with you? They still, after all of this time, ask me, what's wrong with you? It's not enough to care. It's not enough to be a human being. It's not enough. But still, we have to know that we're fighting the good fight for all the good reasons, because I remember a time when people dropped dead and nobody cared.
Thank you, thank you, thank you. And lest we get it twisted, I've traveled around the world with Sheryl Lee, and we've been on the back of the plane, we've been on buses, we've been in cars, we've been in motels.
In vans.
And not only do you talk the talk, you walk the walk, and you show up as a frontline worker, and that's what leadership is all about. So thank you very, very much.
Thank you.
To talk about the role of business and industry, we have one of the leaders in the pharmacy business. Walgreens has stepped out and created centers of excellence and has positioned itself in the front lines of this epidemic. I am so proud of Walgreens because they're headquartered in Chicago, my hometown. So it's only fitting that Walgreens will take the lead on this issue. And so we have with us Glen. Can you talk to us about the role of business and industry, and in particular, your industry in fighting HIV?
Sure, thank you. And this is not the first time I had to follow Sheryl Lee. And it was very similar last time, remember?
Yes, I do.
And so we were trying to out-diva each other, but she won. So,
I wear the T-shirt.
Oh, that's right. So I am from Walgreens. I am a pharmacist. I've been doing HIV work for probably 30 years, and about 24 with Walgreens. And they have always, as a company, as a responsible business, have always come to the table to support the customers, their patients, the people that we serve every day. And over those 24 years that I've been with Walgreens, my entire career has been around HIV. And so I see it from, historical perspective as well. But I do see right now, the last year or so, sort of a shift in the opportunity to help more and more people. So obviously we're pharmacies, we're pharmacists, people come into the store, they say, here's a prescription, can you please fill it? Well, the way I see it, or the way Walgreens sees it is, that's just one part of the community that we want to serve, are the people living with HIV that have insurance, that have prescription coverage, and that are coming in to get their medication. But there's so much more that we could do. And when you look at, prevention and treatment and testing, and we've seen so many different aspects of HIV and serving the HIV communities that we're just looking forward right now to see what else we might be able to do. So we're doing that with partnerships, and we've got some representation here from Kaiser Family Foundation and CDC. We're doing a few projects with them, and we've worked with other people in the room as well, and we're trying to reach out in front of the counter. So we don't want to stand behind the counter anymore and just react to somebody coming in and needing a prescription. We want to see, because we're in the communities, we have 8,000 pharmacies all over the country. 40% of these pharmacies are in medically underserved areas. And we are pharmacists, we're clinicians. We go to college to become experts in medication and in healthcare. We're there as professionals with the door open, and you maybe have never thought about this, but a pharmacist is about the only professional that you could talk to for free. Right? you can't talk to a doctor, you can't talk to a lawyer, you can't talk to a tax accountant, you have to make an appointment, right? A pharmacist, you could call them on the phone, you could walk in and you could talk, and we're trying to create a safe space, a safe environment so people could find the answers to their questions. So part of what we've done is based on a lot of CDC data and some other data that we've had, we looked at our 8,000 stores to see which stores were in the highest impacted HIV areas of the country. And we selected those stores based on which communities they were in. And we gave them information, training, education, and not just the pharmacists, the people at the front register, the people in the store, the technicians, everybody, to create an environment to make them aware of HIV, aware of stigma, culturally competent. How could we help this community, not only if they're HIV positive, stay on treatment, but also prevent and become aware of their status. We've been working with the National AIDS policy as well to see how we can get more people tested. And one thing that I am kind of looking forward to is how can pharmacists be more involved in the retention of people in care? Because obviously, somebody said it earlier, they get the patient in, they get them on therapy, they become undetected, and they don't see them again until they're sick. Well, the pharmacist sees that person every month, hopefully, with their medication, right? There's a role to be played for pharmacists that is always, well, I shouldn't always say always, but oftentimes overlooked or just underappreciated. We want to do this work. We are trained to do this work, but we want to just be part of that.
Thank you. Thank you very much. Roz, I know that you're busy. As a dues-paying member of the NAACP, I know you guys get calls about things every single day. There's probably 15 different issues that yet today you could be addressing. And yet you've taken on HIV and AIDS. It was an issue that you took on very, very aggressively when you were vice chair. Mm-hmm. It's an issue that you took on when you were a youth leader at the NAACP. Why is HIV/AIDS so important to the NAACP?
Thank you so much, Phil, for having this forum, and I was just so pleased to hear all the presentations. So let me just say that formally, and to be on this panel. You asked the question, why AIDS, why now? AIDS is the HIV and AIDS, and our ability to educate the masses about this, I believe, and the NAACP believes, is really one of the most pressing social justice issues of our time, because it is killing too many of our present and future leaders. You've heard the statistics that 1 in 32 Black women will acquire HIV and AIDS in their lifetime. and that half of the new cases in our community will come from African Americans. But what's most staggering is that if Black America were its own country, we would rank 16th in the world for HIV and AIDS rates. Did you hear what I said? If we as a people were a country all of our own, 16th in the world for the rate of HIV and AIDS in this nation. And we must do something about this. I dare say that this room should be filled to capacity, standing room only, for the simple fact that in our community, we're the most likely to become infected with HIV and AIDS, less likely to know we have it, and more likely to die from it. And so it's a whole lot of folk walking around this convention center who may be infected with HIV and AIDS, have HIV, and not even know it. Because they have not been educated. And we have to do more in the African American community about sharing this information. And I'm so pleased that the NAACP is working under the leadership of our health director, Siobhan Arline Bradley, to move this to the forefront. I have one of my incoming board members, Michael Turner from Detroit, who's really a mover and shaker in his community and talking about this issue. He's the chief of staff for the sheriff in Wayne County. And understanding this plague on our men, the NAACP moved out at its annual convention in Houston, and we initiated something that's called the Black Church and HIV and AIDS. Guess what, folks? The Black Church has AIDS.
How about that?
And so many of its members are knocking at the door and tugging on the hem of the garments of those who walk through those doors. And we never turn around and say, who touched me? We never say, who touched me? Because we fail to acknowledge this simple point that I see you. That's what it's all about. It's affirming their humanity, their personhood, but also their right to live with dignity and respect. I would hope that you'd reach out to your local chapter of the NAACP and get this poster and share it with everyone that you know. It is the Black Church and HIV and AIDS, and it talks about the statistics across our country and how in just one snapshot, tell all of your family members and your friends about what's happening in our community. The title of this panel is Leadership Matters, if in fact we want to end HIV and AIDS in our community for an AIDS-free generation. You've heard of the movie The Silence of the Lambs. The problem in our society is the silence of the leaders. The leaders have been silent on this issue. They've also said that if you're in this space, that everybody looks and say, oh, well, you must have it. Right. And so are we not our brother and our sister's keeper? In 2006, at the NAACP National Convention, our leadership at that time, Chairman Emeritus Julian Bond, our then President and CEO, Bruce Gordon, and I was vice chair at the time of the board, we publicly in this space at our convention that we held here in Washington, D.C., we publicly took HIV and AIDS tests for everybody to see. It takes leadership, and you can't be afraid to stand up and be counted and stand up and be tested. So I think we have, as a nation of people, two obligations. One, get out and vote. Two, get tested. Because your life may depend on it.
Thank you, thank you. We've talked about the Affordable Care Act, and the Affordable Care Act is now law. It's been affirmed by the Congress. The next battleground for the Affordable Care Act is going to be on the state level. is going to be around expansion of Medicaid, is going to be around establishing the essential benefits packages. If the essential benefits packages, if the floor is too low, people with HIV are not going to get insurance policies that serve us well. A lot of that work is going to be done by state legislators around this country. And so, Representative Ballard, what role do state elected officials, what role are you going to be playing in making sure that the Affordable Care Act is not only enacted in your states, but that the essential benefits packages include the things that it needs to include, and that we actually are full force on the expansion of Medicaid?
Thank you, Phil, and I'm delighted to be on the panel, but also to answer that question for you. For those of you who may not be familiar with the National Black Caucus of State Legislators, I'm going to set the stage really quick for you. We're over 600 African American legislators. We're in 45 states, the District of Columbia, and the U.S. Virgin Islands. We represent over 50 million constituents. That's a lot of people if you look at the whole state, and we overlap with congressional, the mayors, everyone else in the process. We have already started working on Affordable Care Act. Our mission for our organization as our members is to make sure that our legislators are educated, the cutting edge stuff, what they need to know in order to be able to serve their constituents, how they can be knowledgeable themselves so that when they go to the State House, we can talk about what these issues are. So our organization has been around for almost 36 years, started with 18 legislators because they didn't feel they had an organization that they could really talk with. We've been around a long time. I would ask you one big question. Do you know who your state representative is or your state senator is? You should know. And part of that is you can get those individuals to work for you. Part of working is to find out what do our constituents need. We're that voice. We're the voice for our constituents, making sure that we're providing the kind of care that they need. We have had 2 different workshops already on Affordable Care Act. And you know what's funny? No one has said today Obamacare. And no one has said Obamacare. We've stayed away from it. But did you notice what's going on as far as the White House is concerned? They're saying Obamacare. And part of it is they want to beat them at the game that they're playing in the process. But I say affordable care because, number one, don't we want affordable care?
Yes, we do.
We want our constituents to know that we have affordable care. We also know if we're going to do something about AIDS, and you've heard a lot of people talk about it, so I'm not going to talk a lot about the statistics. But number one, it's the number one killer of African American women. And we look at that, we think about breast cancer, cervical cancer, and all of this. But now we're moving into this other area. But what we have this stigma attached to it. Nobody really wants to talk about it. And as a result of it being a stigma, we go, oh, well, don't talk about it. Or if somebody says, well, I can help you, but I can't help you with that. Why can't you help me with that? Why do we, of all the discriminations we have faced ourselves, why do we become selectively discriminating? We can do that because it doesn't fit with what I think should happen, or it doesn't fit with the Bible, or it doesn't fit with something over here. So we decide we're going to discriminate, but yet we say they are discriminating against us as a people. Well, we're discriminating against other people, and they are a people in the process. Legislators have to be responsive. If your legislator is not being responsive, and as president of the National Black Caucus of State Legislators, and I have members sitting out here today, we know we get elected by helping our constituents. Our constituents don't have the time to go to the Capitol. They don't want to go to the Capitol. They don't know how to do all of those things, but they need us to help them. So as a result, we're going to educate the legislators about the Affordable Care Act. Why is the expanding Medicaid extremely important? Because that can be the biggest asset that can help those with HIV. Because You can get help. Before you didn't know. And what I heard you say, people got it, they died. Now they live longer and longer and longer. But the issue is, are they living quality life?
That's right.
Is it quality that they have? And in that process of looking at that, we have to decide, how do we help people? Expanding Medicaid, they say it's going to cost them a lot of money. Not really. The federal government is going to pay for it. But they don't want to do this. Do we really want health care for everyone else? No, we don't talk about preventive. We only want to do something when people get sick. We need to prevent some of this that's happening in the process. Legislators, we know that. We fight that battle every day in the Capitol. Do something that's going to help people. Not always, is it going to save money? We know we have to save money. But if people are sick, how do we help them? How do we prevent this from happening? So I would look at all these things in terms of, what's our mission? Our mission is to help our constituents. What's our other mission? To speak up when something is not the way it should be. Not to be elected and be quiet, but say something about what is not right. Our big issue that we have, and I would invite you all to go to our website, NBCSL, National Black Caucus of State Legislators, nbcsl.org. You can pull it up right now, nbcsl.org. I want you to go to the section that talks about policy resolutions. All of our legislators who have concerns introduce policy resolutions. And those policy resolutions are ratified by the full body. They are sent all over the United States. They go to Congress, they go to the White House, and those become vehicles for laws later on, what we can do to improve the quality. You can go to your legislator and say, you know, this is something I need, and they can work this up for you. So look at our policy resolutions, because they are there to help our constituents. I will end by saying, we will probably always have some kind of stigma attached. But it says we're talking about leadership matters. There's a poem out there, I hope you will go and look at it, and live a life that matters. Just Google "live a life that matters." It tells us how we have to live, how we have to take care of each other, why we can't look the other way. In closing, I will simply say, there has been so much debate about whether or not the Affordable Care Act is constitutional, that I think people forget or lose sight of what actually is in the Constitution and what the Constitution is about. The very first sentence of the Constitution says, "We, the people of the United States," not "we, the rich people," not "we, the educated," not "we, the privileged people." We, the people of the United States. In order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty for ourselves and our posterity, do ordain or establish this Constitution for the United States of America. Now go back to, in the first sentence, our Constitution. The Founding Fathers said justice, common defense, and general welfare. Inclusion is not only a moral imperative, it is our nation's charge. And as legislators, we have to look at those issues. We have to look at what's legal, we have to represent the people, we have to be the voice, and we have to say when it's wrong, it is wrong, and when you're discriminating, you are discriminating, and we cannot be a united people when we don't think some of our people should be represented. It is both who we are in the Constitution, and it's also who we want to be. And that is a person who cares about each other, who does not let a small segment of the population dictate what we do. Yeah. that we're elected by the people with a voice. We are to use that voice and make a difference in the lives of other people. That's what we try to do. Go to our website and look at, and go to your legislator and help that individual do it. We cannot do it by ourselves.
Thank you. Now, we have a few minutes for questions, but before we do that, because George Curry is actually moderating the next panel, he's going to be stepping out. But a few things. NNPA, the Black Newspapers of America, they can only carry our message if we support the newspapers. If those newspapers go away, we lose an important voice. So if you do not currently subscribe to a black newspaper, if you do not currently use black newspapers where you advertise, you need to do that, because that's our press. Now, and I can tell you that every single week, the black press of America is covering HIV and AIDS in ways that reflects the right messages for us, and we need to make sure that we're supporting them. And also, I'll put in a plug for Heart and Soul as well, because Heart and Soul is going to do a dedicated issue on HIV and AIDS, and so we need to make sure that they're strong and steady so they can do that issue. So there is a panel following this one, so we are going to wrap up on time, but we do have a few questions, and so we want to make room for those questions, and they have to be questions. They can't be speeches or monologues. Questions begin and end with a question mark. Okay, so we have right here, and you have to sing out, Louise, because you don't have a microphone. Thank you, George.
Thank you, John. Thank you so much for your panel. To Sarah, Ralph, and all of you. I am Councilmember Wanda Adams from Houston, Texas. And one of the things, the questions I have is that we hear about prevention all the time. And in the community that I represent, called Sunnyside, among Harris County, is ranked in the top 5 in the country. And then Sunnyside in Harris County, the community, is ranked number 1. What advice can you give a leader who promotes, because you promoting the information about the churches in Sunnyside, which I'm really strong with our health department and helping them promote that. What advice can you give us when we've been doing this now for the last almost 20 years, but we still seeing the numbers rise, and our numbers are rising and rising in this particular impoverished community, low educated community, but the numbers are going, especially among our young girls.
You got to create some programs that are really targeted to
They're
those
there.
young
She mentioned
girls.
them earlier. She mentioned them. Mm-hmm.
I would just mention one. I work on the Douglas County AIDS in my county, and we do the Red Ribbon Art Auction. And part of it is getting awareness. We have 2 different high schools, and each of those high schools have formed their own Prevent AIDS and Help My Brothers and Sisters. We have 2 young groups, and they do it, we just advise. And they have come up with all kinds of what I would call creative ways as young people to do it, hoping to develop a new generation of people building on what has left. So I would go with the younger people and let them run with it and just give the direction they need.
And it's interesting. The sooner you get them, the younger you get them.
That's right.
It's amazing how they change or make different choices for themselves. When I did Enon, there's a big church in Philly called Enon about 8 years ago, and we did the presentation there, and those kids were like, Miss Ralph, you changed my life. I'm still waiting. And I'm like, wow, because they got the information. A lot of them are not getting the information. And if you've been doing something for 20 years and you've had no impact, you got to do something different.
So,
we start with 13.
You're going to be our last question.
Hello, my name is Hadia Charles, and I represent the Harm Reduction Coalition in New York City. I've been working on HIV/AIDS for some time. I've recently transitioned to work on hepatitis C, which brings me to the drug user population. And while working in HIV/AIDS, I did lots of work around women in HIV, and what I realized was that I'd be going out and teaching women how to advocate for themselves, but there were no programs for us to teach the men that they were having sex with the importance of just advocacy. And so my question to the leaders in the room, the Black leaders in the room, is how is it possible to be able to talk about HIV and AIDS, the epidemic that it is, without giving voice to the Black heterosexual man in women's lives? We always cite numbers when it comes to men who have sex with men. We cite numbers when it comes to Black women in HIV, but we, Black leaders, never ever mention Black heterosexual men. It was mentioned here today, but it just doesn't happen. And we need to be the ones to push that agenda, because our men who have sex with men counterparts in the HIV community are not going to do it for us. So we all need to be, speakers and make sure we lift the voice for Black men who are heterosexual.
Absolutely, that is an important issue, and we're gonna turn that to Dr. Cargill and to Janet Cleveland to quickly answer.
Including our test and treat initiatives. Thank you. Our test and treat includes that. The other is, you were talking about, the person talking about women. I was the PI in one of the projects that looked at getting to young women in public housing. Jeff Kelly was the overall PI. I was the PI in Cleveland. And we reduced not only sexually transmitted infections, but unplanned pregnancy, which changes housing, by 80%. And we've published that data. And we know there are ways to do it. I want my counterpart at CDC to talk about it, because Real AIDS Project really is what we're talking about. It involved business leaders, it involved women, and involved their heterosexual male partners to talk about risk reduction, so that we have the tools. There's a compendium of tools. The problem is we often don't look at them, or we forget. We don't let history teach us. Janet?
And just very quickly, Dr. Cargill has mentioned Real AIDS Project. We are currently at CDC also implementing a new research project where we're looking at issues around heterosexual men and what that means in terms of the HIV and AIDS epidemic. So because of time, I'd be more than happy to talk with you after this is over. I would also encourage you all to go on CDC's website as well as NIH, and you can get information about what sort of research we're undertaking right now.
And I want to go to the chairman of the NAACP.
Very, very quickly, because I know our time is out. It's really about education. That's why the NAACP, the younger the better, get in the school systems and the elementary schools, because there's a lot of misinformation. We've even gone on college campuses with our HYPE initiative, Healthy People, Healthy young people everywhere, to talk about HIV and AIDS, and also to give them the testing there. Even at that age, there is a lot of misinformation, and when you're first out of your mama's house, mom and daddy's house, and you just free to be, and you're free to be with everybody that want to be, that's the challenge that we have. And so we're trying to get that information out. Heterosexual, homosexual, transgender, everybody needs to have this information, to have an open and honest, candid conversation about how do we stem the tide. Thank
and
you,
also,
Bill.
just one more thing. A lot of straight Black men are talking, but for a lot of them, it's finding the right place for them to talk. And it's got to be a safe space. Because when I was on the road last summer, and we had quite a few conversations when the Qs had their conclave here in Washington, D.C., and it was amazing, the kind of conversation. But, the space was different. It was all them and only one of me. And they were very willing to talk.
That's right.
But a lot of them were saying that they do not have spaces where they feel comfortable talking, nor do they feel that a lot of the messages that are out there are geared towards them. So they definitely are talking, but I believe, once again, that we must create that space for them to be able to talk freely. And you can visit our website, thedivafoundation.org, thedivafoundation.org. If you drop off you end up with some Canadian divas.
So that's exactly what I was going to ask. How do they find you online?
www.naacp.org.
Okay. Your neighborhood Walgreens, all over the country, there are places where you can go where they're doing testing in the school, in the stores. Places where they're doing centers of excellence, where there's pharmacists that can talk to you.
Text 62227.
Okay.
And I would say, I'm from Kansas. The Walgreens in my town is doing a fine job. I have to say that. I send the young kids to them and the college kids to them. And the other thing is, masculinity is on the line here.
Yes.
When a man's masculinity is challenged, it's too fragile. He can't do it. But if you put him in a safe environment, he is willing to do it. Give him a safe environment, ask his help, and have him stand up. If you believe enough, you will speak out.
Yep. All right, like that.
This conversation is going to continue in a session called In Search of a Black Solution. It's going to be in room 202B, and that's going to follow this session, and so we can continue this conversation. One final word before we leave. One of the keys is increasing our knowledge around HIV. We need to make sure that we have the tools, that we have the knowledge, that we have the HIV literacy to end the AIDS epidemic. And finally, no, black people are resilient folks. No, we were greater than the Middle Passage. We are greater than slavery. We are greater than Reconstruction. We are greater than Jim Crow. We are greater than Hurricane Katrina. And we will be greater than anyone who thinks that we don't take responsibility for ourselves, regardless of where they think they're doing. And we are greater than AIDS. And we want to end with that message. We are greater than AIDS.
Yeah.